So for this video, if you want, you can sit with a copy and a pen. Okay. So basically, I want to talk about how the ECG of a patient with left bundle branch block and right bundle branch block would look like. Okay. So basically, the classical ECG that we know is when the P wave is positive, there is a downstroke of Q, R is positive, S is downstroke, and T wave is also positive. Okay, so this kind of classical pattern you will see when you look at the V6. Okay, so V6 is on the left side. Okay, V6 is on the left side. So if you look at this pattern where there is a downstroke of Q, upstroke of R, and downstroke of S, it looks like a W. Okay. So in normal patient, the V6 will look like W and V1 will look like M. So what will happen in left bundle branch block? So I want you to understand one thing, that is that the shape of the ECG is majorly dependent on the left ventricle. Okay, so if there is a left bundle branch block, then the normal pattern will get reversed. Okay, so the normal pattern is that in V6 we have W and in V1 we have M. So if this pattern gets reversed, then in left bundle branch block we will have in the V6 M and in the V1 W. Okay, so what will happen in right bundle branch block? See, the right bundle, sorry, the right ventricle on the ECG opposes the activity, the electrical activity of the left ventricle. Okay, so if the opposition is lost, then the normal pattern will become even more exaggerated. Okay, so the normal pattern is that in V6 we have W. Okay, so in right bundle branch block also in V6 we will have W, but this W will be more clearly visible. Okay, it will be in some ways more bigger. Okay, it will be more clearly visible. And in normal patients we have what on V1? We have M. Okay, so in right bundle branch block this M will become accentuated. Okay, so so let us revise once. So in normal patients in V1 there is M and in V6 there is W. In left bundle branch block on V1 there is W and on V6 there is M. In right bundle branch block in V1 we have M and in V6 we have W. Now if I have made any mistake in this video, then please try to ignore it and focus on the concept that I'm trying to give. Okay, so if you focus on the concept, you will be able to derive the answers even if my answers are wrong. Okay, so there is also one mnemonic. So I have not made this mnemonic. Okay, this mnemonic is from an Instagram channel which is of Mr. Kashif. Okay, so the mnemonic is William Marrow. Okay, so the L in William represents left bundle branch block. Okay, so first we have W and then we have M. So in left bundle branch block in V1 we will have W and in V6 we will have M. Now look at the word marrow or morrow. So the R represents right bundle branch block. Okay, so in right bundle branch block in V1 we will have M pattern and in V6 we will have W pattern. Okay, so one thing I have seen, and that is that the shape of the QRS wave is much more complicated than the shape of the T wave. Okay, because QRS has got three components. Okay, uh, but one thing that you may notice is that the main wave of the QRS is the R wave. Okay, and the direction of R wave is the same as the direction of T wave in V1 and V6. Now, how is it possible? Because R wave represents depolarization and T wave it represents repolarization. So why is this? Like, why is the direction of these two waves the same? Okay, so what basically happens is that depolarization occurs from inside to outside and repolarization occurs from outside to inside. Okay, so because the direction of repolarization is opposite to the direction of depolarization, okay, so that is why minus minus is equal to plus. The direction of the T wave in a normal person is same as the direction of R wave. Okay, so let us look at the T wave. Okay, so the direction of the T wave is determined by mainly the left ventricle, because left ventricle is the thicker ventricle. It has to supply blood to all parts of the body. That is why it is very thick, it is very muscular, it has got many cells. Okay, so that is why it dominates on the ECG. Okay, the patterns that you see on the ECG is dominated by the left ventricle. Okay, so in normal patients, in V1, the R is in normal person, normal people, not patients, maybe patient. In normal people, in V1 the R is negative, and in V6 the R is positive. Similarly, uh, in V1 the T is negative, and in V6 the T is positive. Okay, so what will happen is that in left bundle branch block, um, uh, the pattern will get reversed. Okay, so T will become in V1 positive and T will become in V6 negative. Okay, and in right bundle branch block the pattern that we normally see will be present, but because right ventricle opposes the left ventricle and because the opposition has been removed, that is why what will happen is that the normal direction that is seen in normal people gets accentuated. Okay, so what will happen is that in right bundle branch block, the uh, T wave it will be negative, and so in V1 the T wave will be negative in right bundle branch block, and in V6 the T wave will be positive. Okay, so I want you to focus on the concept, and if even if I have made some factual mistakes, I think if you use this concept you will be able to derive the right answers. Okay, hope you liked the video. Thanks for watching.